As a physical therapist, what would I do if I had low back pain? I'm Dr. Morgan Riggins. I'm a physical therapist at OPAL Movement Therapy, and today I'm going to go over a couple of gentle movement drills that I would do if I had a case of low back pain, right? And as someone who's had chronic low back pain in the past and is pretty much in maintenance mode, I have like one flare-up a year at this point. I've had a lot of experience with what are some of the movements that we can do. The majority of low back pain is mechanical, and mechanical problems require mechanical solutions. So we're going to go over some gentle movements that can be safe to do, right? And when we have pain, a lot of times our tendency is to not want to move, but sometimes doing some gentle movement earlier on can actually help with the healing process and help get out of pain faster. But it's not a one-size-fits-all approach. And so today I'm going to go over what I would start with and how I might adjust that depending on my symptoms. So if I, tweaked my back, maybe it was on a long run, or maybe I got a little sloppy on my deadlift form in the gym, or maybe I did a bunch of yard work, or I, spent a lot of time in the car on an airplane and my back started hurting. The first thing I would do is see if I can get onto the ground, and more often than not, I could. And if you couldn't get onto the ground, these are also a few gentle things you could do on your bed, and so that's an option as well. It's going to be a little bit squishier, so if you can get to the floor, that's ideal, but worst case scenario, you can also do them on your bed. And so I would carefully get onto all fours, and of course, when your back hurts, transitional movements is a problem, and so just take your time. And then once I'm in all fours, I'm going to see if I can start doing some movements here, right? And then I'll go over some alternatives if this is not going well. But if you can get to here, the first thing I like to start with are hip swivels. I'm just going to gently slide my feet to the left and right. And I'm getting a little side bending motion in the back. And it's kind of like I'm fishtailing my back a little bit. And I want this to be as pain-free as possible. And so I'm not going to go super far to where it hurts. I'm just going to keep it in a tiny little range, and it's normal to feel like you might not be able to go as far one direction versus the other. Don't force it. You also have the option to round your back a little and then swivel. That might be more comfortable. If it is, do it with a little round in the back. If it's not, if it's the same or more painful, then go back to just kind of a flat neutral spine and see if that's better. If that's still not great, you can also relax your belly down into extension, and you can see if extension feels better. So since it's most likely a mechanical problem, we need to find the right mechanics for what the joints, the muscles, and the nerves in the low back want, and we want it to be pain-free. So hip swivels are my first choice, either in neutral, rounding, or dropping into extension. And then after we do some hip swivels, right, we're trying to get a little lubrication, little movement, blood flow into the back. If we're still doing okay, then I would just gently round a little, gently extend, and whichever way hurts the most, I'm not going to crank on it, right? So it might be like, maybe it feels better to round, so I'm just going to go from neutral to rounding. If it feels better to extend, then I might go from neutral to extending down like so. And then whichever version is more comfortable, I'm going to add a rock back. So if it was more comfortable just here in neutral, I'm just going to rock my hips back and get a little gentle movement. And I'm only going to go as far as it feels good. Now, if it was more comfortable to round, then I'm going to round as far as it is comfortable, and I'm going to rock back, keeping it rounded. If it was more comfortable in extension, I'll drop my belly down and then rock back in extension. Okay? And so I'm going to pick the ones that are most comfortable, and then I'm going to go back to hip swivels. And I can start hip swivels with like a flat neutral spine. It may already feel freer than the first time, or I may need to add that directional bias, whichever one feels better for me. So I might need to round it again with the swivel. I might need to relax it into extension with the swivel. So you're trying to find which direction your back wants to move, and that's going to be the more pain-free direction. You could just pair these together, so hip swivels with whatever bias, and then either a little rounding and rocking back, or a little extension and rocking back. Now the next one, if all of that's going well and it's loosening up, this would be a progression. If this is feeling a little bit better, but it's still kind of spicy, then I would stop at that point, rest, stand back up, walk around, or relax on the ground and take a break. But if it was going well, then I could try to string them together and do a little child's pose to Cobra. So I would gently round, coming back, just a comfortable range. Then I'd walk my hands forward. I'd stop my hips here, gently open up the chest for a little extension, stopping before pain. And it may be a tiny motion. Like if I'm really in a lot of pain, it may be baby child's pose and then like a little baby Cobra, but this is still getting some movement. And this is very similar to like when we have to stand up and sit down. So it's important that we can get this moving better. And then eventually, if I did my hip swivels, my little Rockback, and my child's pose to Cobra, if I do a few of these a couple times a day, that's likely going to get those joints, muscles, and nerves moving a little bit better. And then the other option is, say being on all fours is just not comfortable and it's too painful, then we can get you onto your back. And here on your back, just settle in at first and see how we're doing. Typically, it may be more comfortable with the knees bent and the feet on the ground. It just puts the spine more in neutral. Instead of when your legs are out, then my back wants to get pulled into extension. That might not feel good right now. It also stretches out the nerves in the low back. And if there's a little nerve component, this can be spicy. So instead, feet are on the ground. And then here in this position, even just breathing and taking really big belly breaths can be helpful. We can also find a more comfortable position for the spine. So I could just gently round my back and then I could gently arch it and I could see which one feels better. And it might feel better just right halfway in the middle and neutral. But if it feels better to round, I can round and go to neutral, round and go to neutral. Or if it feels better to curve, I can curve it, create space between me and the floor, and then return to neutral and then curve it again. So kind of like what we did on all fours, just find the direction it wants to do. And then the other one, once you find which one's the most comfortable, say for me it's right in neutral, then I can add a very gentle windshield wiper motion where my hips are going left and right. And I'm going to keep it as pain-free as possible. So it may be a very tiny motion. If it feels good, I can go a little further. But remember, we want to go up to, not into pain. And if you needed to, you could round your back a little bit as you do it. And those are all good options. Last but not least, sometimes there's a nerve component. And so doing some nerve mobility can be helpful. And so we'll bring one knee towards the chest, just kind of take inventory. Now note, my hip and knee are about 90 degrees. If I pull it up really far, that may start to light up my back. So I just want to do what's comfortable, right? Once again, we're going for pain-free movement. If this feels okay, then I could start to add a nerve glide. If this wasn't going well, I could see if it felt better with both. And I could even hold my own hands so I can kind of relax. If this is too spicy, then we would just skip this one and move to one of the others that we already did. But if it is going well, we're going to just gently bend and straighten the knee. We don't want to hold this stretch. And you may feel this a little in your back and you may feel it go down the leg. But as long as it changes when it's straight versus bent, then we're good. If it just feels like the back pain is ramping up, then we would want to skip it. I also recommend if there's a side of your back or even into the buttock or glute, like that feels more painful, do that side second. So like if it's tighter on my left, then I'll do my right side first. And I just might do like 5 to 10 reps. And then I take inventory over here. How's the back doing? If this feels pretty good, I'm gonna just gently straighten. And if one side is spicier, I just might barely straighten and then come back down. And I could do, 5 to 10 reps. I could do this a second time and I might get a little further. If it feels good, I can get my ankle involved. Once again, we're gliding those structures from the back to the feet. And as long as it's tolerable and it changes when the leg moves, then we're good. And then at that point, that's like 3 or 4 different mobility drills. And we would just want to incorporate a couple of these more often throughout the day. So after doing a few, I would want to get up. I would want to kind of take inventory, like how does that feel? Did I overdo it? Do I need to do a few more? And then either, resting if being on your feet is too uncomfortable, taking a seat, lying down, those could be good options. Or in some cases, it feels better to stay up and moving around and it's being still that's more uncomfortable on the back. So then I might just do a gentle 5-minute walk around the house. And then in a couple hours, I would run through those again. And the whole goal is pain-free motion just to get some movement in there. And then of course, if it's not resolving, then get it checked out by a qualified provider. I hope this was helpful. If you liked this video, go ahead and hit like on our YouTube page and feel free to subscribe. And if you hit the bell, you'll get notifications from when we post a new video. We post a video on YouTube each week, and then we also post every day on Instagram and Facebook, so check us out there as well.